Hello, friends. Welcome back to Your Health Kenya with me, Trisha. It is another Friday that we get to do another episode just unpacking this conversation on reproductive health, particularly for women. And we pick up from our previous conversation where we were talking about what is normal period versus what is abnormal. And today's conversation, it is going to be about hormonal imbalance. I know a lot of women do ask themselves, questions about, if something changes with their periods, is there something off? Does it have to do with hormonal imbalance, and just getting to understand what hormonal imbalance is? And to unpack this conversation, it is our guest, Dr. Wasuna, who is a gynecologist, and he'll be helping us unpack today's conversation. Dr. Wasuna, karibu sana once again.
Thank you very, very much. It's my honor and pleasure to be here, Trish.
Yes.
To share knowledge.
Yes.
Us from information to understanding.
Kabisa. And from our last conversation, we were talking about what is normal versus what is abnormal, periods. And part of that conversation, we talked a bit about hormonal imbalance. And I want us to pick up from that conversation. So what is hormonal imbalance and what causes hormonal imbalance?
Right. So basically, to recap, we said that a lady's reproductive cycle, her whole makeup is governed by these chemical messengers. And we talked about two hormones previously, estrogen and progesterone. And the two have to be produced in right timing and amounts to ensure that all flows. A woman has a regular cycle. Regular to us means every 21 to 35 days. Should not be too heavy, should not be too painful. Okay? And so let's first look at the scenario. A lady walks into the office, and when I look at her, I can tell she's struggling with acne, pimples. I look very carefully, and I see that she has a mustache, slight, or she's struggling with hair here. Okay, she sits down and tells me she's having problems with her periods. They come 2 to 3 times a month, or sometimes they can skip 2-3 months and come and they're very heavy, or 6 months and they're gone and they come back. And she's not around the age of menopause. When I look a little closer, I realize she tells me from history, Doc, and I'm putting on weight. And it seems to be all up here. I'm top heavy. And I'm eating irresponsibly. Hormonal imbalance has struck. So the scenario that I've just given you is possibly what a patient with hormonal imbalance will come talking or complaining about. My periods are haywire. I'm now struggling with acne, with pimples, and I used to have good skin, doc. I'm growing hair where I should not be growing hair. Okay? Sometimes I miss periods and they can go for months. What do I do? Okay? The commonest cause in teenagers and early young adults of what I've just discussed and what would come out as what is normally in the population known as hormonal imbalance to us, I would first look for a condition called polycystic ovarian syndrome. PCOS, so PCOS. Poly means many. Cysts mean little small bubbles seen in the ovaries representing eggs which somehow never left. I'll explain that.
Okay.
Ovarian syndrome. A syndrome means a group of signs or symptoms. That come together. So it's a group of things we come together and say, all this fits into this one condition called polycystic ovarian syndrome. Let me explain. We've talked about previously, there's a part of the brain called the hypothalamus. It produces a certain hormone called GnRH. That hormone tracks down to just beneath it. There's another gland. A gland is what produces hormones also. It produces the anterior part of the pituitary gland. That's like the super CPU gland of the human body. The anterior, the front part of it, produces 2 hormones. They're called gonadotropins. One is called follicle-stimulating hormone to stimulate the growth of eggs. The second one is called luteinizing hormone that causes ovulation to happen. These 2 also come down and cause the ovary to produce the female hormones, but also to produce a little bit of the male hormone. Now, we talked about the hypothalamus producing this GnRH. It's supposed to be produced in a certain pulsing pattern. But if the pulsations are off, the body has a clock. This is the theory. It causes too much of everything else to be produced, and down at the level of the ovaries, too much, male hormone to be produced. Now, when too much male hormone is produced in a woman, it'll also cause her to have a kind of condition which is common and akin, closely related to diabetes. We know diabetes is a sugar thing. Now, what do I mean by that? There's a hormone called, this is all about hormones, and we're in school here, so bear with me. Are you with me? There is something called insulin in our bodies. We know what insulin is. Your body produces insulin to ensure that sugar levels are reduced to the normal.
Yes.
But if too much insulin is produced, the body gets resistant to it. You know that friend who calls you once a day, you're happy. If they call you 10 times a day, you're not happy. You get resistant. You're like, you will not want to receive that call. So too much of something can be bad. So too much of insulin, there's insulin resistance that is caused. And with that also, weight gain. With that also, problems in how fats are handled in the body. With that also, that's why we talked about the weight gain, fat. And so you'll have risks of strokes and all that. So this whole thing is part of polycystic ovarian syndrome. At the level of the ovaries, eggs grow but never leave the ovary. So they park just under the surface of the ovary each month. So with time, when we do a scan of that ovary, it'll look like a golf ball. First and foremost, it's swollen. Number two, there are eggs that are parked. They look like, those are the cysts now I talked about. Okay? And because of the fact that no ovulation is taking place or minimal ovulation is taking place, now we also have infertility, difficulty in conceiving because the eggs never really leave the ovary.
Okay.
It's like that baby at 45 not leaving home.
Yeah.
Very annoyed.
Yeah.
Get out of the house. So that's what's going on inside this polycystic ovarian syndrome. It sets up the whole syndrome, the whole spectrum that gives us this picture. So there are treatments for polycystic ovarian syndrome.
Yes, and I think that's what I wanted to go into next.
Okay.
But just to clarify some of the things that you've mentioned about. So you've talked about some of the symptoms
Yes.
for hormonal imbalance.
Correct.
And then you've linked hormonal imbalance to PCOS,
Correct.
PCOS,
Correct.
as the major condition
Yes.
of hormonal imbalance.
Correct.
And you've also mentioned about insulin.
Yes.
So is insulin linked to hormonal imbalance from what you've mentioned in terms of, so insulin is the regulator, of sugars in our bodies.
Yes.
So when there's
A resistance to it.
Yes.
So this is how it works. When you and I eat food,
Mm-hmm.
it has sugar in it.
Yes.
Sugar's in blood.
Mm-hmm.
So sugar is not needed in blood.
Mm-hmm.
It's needed in our body cells to produce energy that we need to talk as we're talking.
Mm-hmm.
It has to enter into the cell somehow.
Mm-hmm.
So what happens? At the cell, there are receptors. They're like doors.
Mm-hmm.
Okay? So sugar is outside in blood.
Mm-hmm.
A messenger, okay, that's like room service, comes and knocks on the door and says, I have a delivery of sugar for you, open.
Okay.
That messenger
Is the insulin. Yes.
Now the door has to understand what insulin is saying, open up, and in comes the sugar. Bob's your uncle. You're good to go.
Okay.
Now what happens if insulin is present and is knocking? That's the waiter with the room service is knocking at your door in the hotel, but that door is not listening, doesn't understand, is resistant to the knocking, so it doesn't open. That is insulin resistance, and that compounds the problem and sets up again the hormonal imbalance, because the effects of insulin resistance are not just weight gain and other things, but also causes your ovaries not to release the eggs. That causes the hormonal imbalance now. Again, androgens, which are male hormones, the andro part of you begins to rise. Hence now you begin to see them looking like a man.
Okay.
Libido changes happen. Okay. When the male hormones are rising in a woman, her libido might be sky high because that's testosterone, the male hormone, the andro part of you is really high. So we begin to see changes in a lady there.
Okay.
Right.
So not just physical changes, but we're also seeing changes even with her menstrual,
Absolutely.
Emotionally,
Yes. Psychologically,
yes. But also with her menses.
Yes.
All right. Okay. So I want us to go into the treatment options for, so ideally hormonal imbalance causes PCOS. So what are some of the treatment options for other women who can just have hormonal imbalance without particularly having PCOS? Many
of them, they could have mild forms of it, and so they wouldn't even know.
Okay.
Okay.
So there's the mild form of it.
The mild form. So when we talk about, not every woman with, for example, polycystic ovarian syndrome is going to have classically all the symptoms we have seen.
Yes.
Okay. Some might just be mild, just with acne.
Okay.
Others, when you look, you'll find her periods are not that bad, really.
Okay.
Okay. But the real syndrome, full blown, has all that, especially in teenagers.
Okay.
Will have everything. They'll have a problem with their periods.
Okay.
They'll have a problem with multiple little small cysts, the eggs that never left in their ovaries. And then the andro part of the androgens, the male hormones are high. Those are the three components that we use to say you really do have this particular syndrome.
Okay.
But largely, that's very academic. Women will say, I have a hormonal imbalance problem if they're having menstrual issues.
Because it's usually highly linked
That's it.
to menstrual
That's
issues.
the first, yes. Or, doc, look at my face.
Okay.
Help me out here.
Yes.
I'm struggling. There you go.
Okay.
So menstrual issues, it could be very heavy, multiple, absent, irregular, no rhythm, no rhyme.
Yeah.
That is what would bring them to us. And that is what they call hormonal imbalance, which we interpret in terms of other things. She could also have other growths that are producing hormones which are interfering with the cycle. Okay? Right. So we've heard of ovarian cysts, other cysts that are producing hormones which interfere with her normal hormones. Okay? That's another that can cause an imbalance.
Okay.
Okay? I've just thought of something else that actually can cause a bit of an imbalance. Commonly, I get asked the question, do hormonal contraceptive methods, can they cause me to have an imbalance? Well, it depends on the kind that we're using. There are those that have both estrogen and progesterone, both, but those make you very balanced. In fact, we can use them to ensure that a woman's cycles are extremely regular. But there's now a proliferation of people using and abusing, for example, it's called the morning after pill, P2. That's given as emergency contraception if there's been unprotected sex at the time when a woman could conceive or a girl could conceive and does not want to conceive, and they take it. It's a high dose of progesterone alone. That for a while, we normally counsel them that for 2 or 3 months, you could have something haywire in your periods. For example, you could have bleeding in between, sometimes acne or 2, things like that. So that's expected. So that's a temporary imbalance that's been caused because of this particular medication.
Okay.
But generally, normal birth control methods will cause a woman to be balanced if they have both hormones, estrogen and progesterone.
Okay. Right. Now let's talk about treatment.
Okay.
As well as just talking about, now that you've brought up contraceptives as part of the treatment, and what your advice would be concerning that, because I have encountered women who have PCOS and the doctors recommended contraceptives as a treatment option for regulating their menses. But let's talk about that, treatment options for hormonal imbalance. And
all right, so you've already let the cat out of the bag. So
yes.
when we it's a big cat.
Yeah.
When we call, by the way, cat in my language is called Nyambura. Do you know that?
Oh wow. Oh yeah, actually that's true. Yeah. Luo, yeah.
Hi Nyambura.
Yeah.
All right. So when we call them contraceptives, we do them a disservice. They're actually hormonal pills, which we can now use for different reasons. We can use them for contraception. We can use them to reduce bleeding. You can use them to reduce pain. We can use them to reduce, to regularize the cycle. We can also use these same hormonal pills, which are called contraceptive pills, for example, to delay a woman's menses. Imagine menses coming on your honeymoon or on your wedding day. Not worth it. So we can use them for all those. So those are hormonal pills. So we can use hormonal treatments. But before I go to those, let's begin with the easiest. Did you know that losing 6 to 10% of body weight alone can have a great effect in making a woman's periods that were irregular because of hormonal imbalance, PCOS, better? Because what are we doing? What's causing you to lose weight? You're dealing with the insulin insensitivity or the insulin resistance. So things like intermittent fasting, dieting, and exercise, reducing the amount of carbohydrates, sugars that a woman eats. And when she loses weight, 10% of body weight, a lot of clients, patients will notice their periods become better. They become regular. The hormones are balanced. Her skin improves. Okay? So let's hit the gym, people. Let's do something. Okay.
So first treatment is lifestyle changes.
Lifestyle changes. We'll start there.
Okay.
But that can take a while. It could take 3, 4, 5 months, for example. So we also want to treat with other things.
Okay.
You could find that the periods are so deranged and heavy, they're threatening her health. We get something called anemia, low blood levels, hemoglobin, which is the pigment in blood that carries oxygen. So, number one, we would want to give things that can reduce the bleeding, the heaviness of bleeding. We can do that. Some of those are standalone medicines to reduce the bleeding. Others also are painkillers, which also have a good side effect in reducing bleeding.
Okay.
That's treatment. 3, we can also control the cycles now, which means we give them hormonal pills, the ones which have both estrogen and progesterone, or various types, that can make sure she's regular and she's lighter. If there's pain, again, we can treat that. Okay? That will really help. So it's wide. Long ago, there were treatments where we'd go in and we would, through what is called keyhole or laparoscopic surgery. And this was especially for women who wanted to conceive. We used to poke at those ovaries, to poke those cysts. But we don't do that much these days. Okay. There are many other treatments. There's a new molecule called inositol. It's a type of sugar. It's supposed to come packaged with I'll use the word, a cousin of it's called D-chiroinositol. So basically, this is 2 molecules which are cousins of each other in a certain ratio. It comes, and that's available in our drugstores. Of course, it's prescription medication. That holds great promise in controlling PCOS, regularizing the cycles. Remember, I talked about the 3 arms of government that have to agree. The hypothalamus, the pituitary, and the ovaries, that axis to regularize it and give normal cycles. So basically we can use that, which is non-hormonal also, by the way, to make our hormones regular. So we don't just use hormonal treatments. This new one has also come into the market, and that's, a good gynecologist should be able to help in that regard.
Okay, so is that one of the latest emerging treatments
It is.
for PCOS?
It is.
All right. And I think I'll go back a bit when you're talking about anemia. So part of the treatment for anemia, you said, is... So
we will want to make sure that the periods are lighter, because anemia means she has low blood levels because she's losing.
Yes,
but we can also give iron.
Yes, iron supplements.
Indeed.
Okay, as well as just
dietary iron.
Dietary.
So what's in that? Dark green leafy vegetables, meat products, and liver. Yeah.
All right. Okay, great. I was going to ask that question of which you touched a bit on, but does hormonal imbalance in PCOS lead to infertility?
Good.
Yes.
That's a good one. Yes, it does, because in polycystic ovarian syndrome, we're having cycles where ovulation does not take place. The eggs never leave. Hence, they're seen stacking up in the ovary, making the ovary big. In fact, by the way, when you see an ovary that is over 10 cubic centimeters by ultrasound or bigger, that again tells us that there's a problem there. So it naturally will cause an inability to conceive because eggs are not leaving. So there are treatments we can use. Number one, if we reverse the insulin insensitivity, we also used to give, by the way, sorry, I should have mentioned, the medicine that is given to diabetics, not the injections, the tablets. Those also do the same work kind of what inositol was trying to do. We're trying to reverse the insulin resistance. So when you do that, some of the ladies will begin to also lose weight and begin to ovulate. So these are some of the treatments. We can use also medicines, which drugs, which can cause her to release the eggs to ovulate. So people call them fertility enhancers. Yes, they are there.
Okay.
So yes, it is true that polycystic ovarian syndrome or certain kinds of hormonal imbalances can cause difficulty in conceiving when everything else is okay. Sperm are okay, the uterus is okay, the tubes are okay, but the eggs are just not releasing. They are getting released from the ovary. So we have treatments that can cause her to ovulate. Fertility enhancers, yes, they are available.
All right, which is a good thing that there's hope, regardless of.
There's a lot of hope. There's
regardless
Namura,
of the.
And then there's hope.
Yes. All right, great. I want to learn this conversation, and my final question is: would you unpack maybe some of the misunderstandings or misconceptions about hormonal imbalance and PCOS, if any, that you know of? Any misconceptions or misunderstandings?
Okay, number one, the first misconception I want to deal with is that hormonal imbalance necessarily is caused by birth control. That's number one. Infertility is caused by birth control. That's the first one. I think that's the first cow I want to slaughter. Okay. The causes of infertility, inability to conceive, are either the tubes were damaged, there's a problem with sperm, or there are environments within a woman's body that are fighting sperm, fighting conception from happening. So we call it male factor, that's the man, or female factor. By the way, each of the sexes contributes equally into this melting pot that we call infertility. 35% of couples, the woman, 35% of couples, the man. Okay, that happens. Birth control methods typically are licensed to be reversible. So the misconception is, if I take birth control, for example, a woman is newly married and she thinks, if I took these, when I want to get a child, I'll have a problem. No, that's not it. They don't cause it. Something else will be the cause. So once you cease taking birth control, you should be able to conceive.
Immediately or over a period of time? Because I think that's one that I've heard a lot.
One. Thank you. There's one particular method that causes quite a bit of a tail end. That's the injection. There's an injection, Depo-Provera, we call it. That can cause a inability for up to a year, but it should come back unless there are other factors that are coming to complicate this whole melting pot. So the biggest misconception is that birth control methods cause infertility. They don't. Okay. Is hormonal imbalance caused by food? Types of food. Obesity. Obesity can affect a woman's balance. That is why losing weight can help through various mechanisms. It's all to do with insulin. So obesity basically is an enemy to fertility. Likewise, by the way, we swing it all the way to the other side. Being too light, bulimia, and people who have anorexia where they feel that they're too big and yet they're not. That also. I think below the for some people below 45 kilos, not good. Okay, or unless she's petite. People are really thin. Your body goes into starvation mode and says, "I will survive. I'm not going to go into." So I think the biggest one I just wanted to tackle, because there are many, was the fact that, you know what, birth control, hormonal pills don't cause hormonal imbalance.
All right. Great. What a great way to land that conversation. Thank you so much, Dr. Wasuna. Well, that brings us to the end of today's conversation, just about hormonal imbalance and PCOS or PCOS. And I do hope that you've gleaned something from today's conversation and that you are able to take charge of your life. I think I cannot emphasize more than the doctor has in regards to, just lifestyle changes. What are you doing in regards to the type of diet that you're eating, in regards to exercise? And it doesn't necessarily have to be at the gym, but even simple exercise like walking, but just ensuring that you are taking charge of your life. Well, that's it for today's conversation. We will be continuing with this series on reproductive health for women. Until next time, it's a goodbye.
So if there is no that high fiber diet in your food, it means that this particular insulin might in turn become what? Resistant. And if it's resistant, hormones like estrogen will not be produced. Okay. And you find that a woman, instead of producing this estrogen, is starting now to produce male hormones. Like the androgens. And these particular androgens now, they're the ones that bring about having disorders like PCOS. Yes. So in that case, we need this fiber to enhance what? The functionality of insulin.